Watching with us. So with safer at home orders in effect and medical resources under pressure, some folks are concerned, rightly, about access to medical care during this intense and stressful time. We've been reporting on the fact that San Bernardino County's ambulance services and concerns about their ability to respond to non-COVID patients. It has a lot of folks worried about how to seek health care safely during this surge of COVID-19. So we decided we'd call on Dr. Karen Hansberger. She is the Chief Medical Officer at Inland Empire Health Plan with what you need to know. The doctor is in. Thank you, Dr. Hansberger, for being here. First of all, I think there's some questions that you could answer for us. What do people need to know about whether it's safe to go to the doctor this week and the next couple of weeks?
Well, you know, we've had some time to get used to this COVID epidemic and find safe ways for people to get in to see their doctor. So your doctor and your healthcare providers are prepared, and they have protocols in place to keep you safe if you need to be seen.
Okay.
So calling them if you're...
No, go ahead. It's best just to get in touch with the office if you have an issue, and they'll sort of walk you through what they want you to do, right?
Exactly, and many of the concerns that you may have, like refills of your prescriptions, can be done over the phone, and you can have a televisit with your doctor or a Skype visit, and sometimes you don't even have to go in.
Can you dial into the telehealth system a little bit really quickly for some people who have never done it before? It might feel a bit like talking to a robot. Demystify it a little bit for them.
Yeah, so telehealth is really talking to your doctor like you're talking to me. I'm not with you in the studio. I'm here in my office. The same thing would be true. And we can do it on our little smartphones, you know, just right here, or we can do it on an iPad. And also we can just have a conversation on an old-fashioned phone. That counts as a televisit too. Absolutely,
because sometimes you just need to hear the doctor. Sometimes they need to see whatever the issue is that you're dealing with. So walk us through what appointments are important to keep and what appointments are okay to pause on for now.
Well, you know, I think it depends on the time frame. So, you know, it's still important to invest in your health during this time.
Yeah.
But, you know, you might want to put off a mammogram for a couple of weeks until things have calmed down with COVID and not have that done right now. But we don't want to put it off for 6 months or a year. And so we have to get on with life. And again, our healthcare providers, they've had some time to get used to this. They know how to clean and to schedule so that you are safe when you go into these appointments. So don't be afraid to access healthcare. Certainly, if you feel sick, you need to access healthcare.
I anecdotally got a text message from a friend urging me to do that very thing you talked about, is not put things off, because they had quite a scare in their circle, someone who did put it off and then got a scary diagnosis. So it's an important thing to remember. Okay, so again, telehealth, call your doctor if you have questions. If you are in doubt at all, just pick up the old-fashioned phone and give them a ring. And then I think the question about things like elective surgeries, obviously not a good time to be doing those if you don't have to, correct?
Correct. So it's time if you have maybe a knee replacement or, you know, something that maybe really needs to happen. But if it happens today or if it happens in 2 months, it probably doesn't matter all that much. So if you can find a way to put those off for a little while, it's really it's much safer to do that. But procedures like maybe procedures on your heart, or if you had a gallbladder that was acting up and giving you a lot of problems, those would not be considered elective. And you don't want that to flare up in the middle of the night and have to deal with that crazy emergency room.
Very good point. Very good point. And lastly, since we have you, Doctor, we've got a white coat here with us. Make the case for why people need to take this virus very seriously right now. We're leaning on all of these medical professionals to do that.
Absolutely. I know we are all so tired of this. I personally am so tired of this. I want it to go away too. But we have a light at the end of the tunnel. We're going to have vaccinations for this very soon. This is not the time to let down our guard. We need to double down right now and keep ourselves safe. Wear your mask. wash your hands frequently, carry your hand sanitizer, socially distance yourself between others, stay in your family pod as much as is possible. And, reach out in other ways, like call your neighbors, see what they need. We are all in this together, and people are suffering. And so we need to be there for each other, even if we can't physically be there for each other. We need to be there for each other so we can all get through this together. And we'll be, in a few months, on the other side of this. We'll have our vaccinations in place, and we'll be able to go back to life as we have known it and enjoy it and love it even more, because we went through this dark tunnel. So please, please double down on all that you are doing.
Absolutely.
To keep yourself safe and your family safe.
Dr. Hansberger, thank you very much. Your passion was felt, and we know the urgency of it. Thank you so much for joining us on the air to communicate this vital message at this time. Stay safe.
Thank you for having me.
Absolutely.